We've asked you to send in some of your questions and we're going to answer them. This mom says she's a new parent of a 6-week-old, but she's struggling with some severe sleep deprivation. What are some strategies that you can suggest to help both her and her baby get better sleep? And she's wondering if she should consider sleep training.
My boy is 10 months old who has not yet been introduced to shellfish. Is this an allergen type food that I should try to expose him to ASAP?
She says she's read about the importance of secure attachment in the early months, but she says she's worried because she has to return to work soon. Her baby's 3 months old and will be going into daycare, and she wants to ensure a strong attachment with her baby despite going to be spending a bit less time with her.
Kath, my little girl is now 8 months. I would like to start including more starch now as finger foods. I assume just normal bread is not great yet. Is there a better option for them? What about whole wheat pasta or even chickpea pasta?
Everyone, and welcome to Let's Talk Baby. I'm Kath Megaw. I'm a paediatric dietitian, and I'm joined by my co-host, Dr. Jenny Rose, who's a clinical psychologist. It's so exciting to be back with you again. And today we're doing a really, really cool episode because we've asked you to send in some of your questions and we're going to answer them. So thank you so much for sending in questions. We got so many, and we will definitely get to all of them over time. So I'm going to start right away with Jenny. And your first question was a really good question. And I think a question that resonates with a lot of parents, new parents specifically. This mom says she's a new parent of a 6-week-old. How cute. But she's struggling with some severe sleep deprivation because her baby wakes up several times a night. What are some strategies that you can suggest to help both her and her baby get better sleep? And she's wondering if she should consider sleep training. And if so, when do you think is appropriate to start? So that's a really good question.
Yeah, that's an amazing question because I think it's such a relevant one. And I think new moms just really are thrown in the deep end when it comes to sleep. And it doesn't matter how much we might think that we can prepare ourselves for what is to come. We just often don't know. And I think accepting this transition is such a big part of the journey. So the first advice that I would want to give this mom is just to firstly normalize that a 6-week-old baby should be waking up several times a night. And actually that means you're doing so well and your baby is on track and that there's good growth and development. And that's exactly how we would anticipate the journey to go. So, I think we fall so badly into this trap where society has built this idea that your baby needs to sleep through the night. And we are so guilty of it as moms as well. And as fellow community members, is when we hear somebody's had a baby or when we check in with the new moms, we say, how's your baby sleeping? And how terrible if they're not sleeping through the night. Yeah. And when you actually sit back and ask most moms, how many of your babies are sleeping through the night at 2 months, 6 months, even at a year? There are very few that would actually acknowledge or admit that their child is in fact sleeping through the night. And I think on the contrary, it's far more normal to have a child waking, especially in those early few months. So to me, it's really just around normalizing the idea that waking is totally appropriate at this age and that we shouldn't be trying to intervene with that. You will come in, Kath, with the nutritional gold of how important it is that that baby actually is still getting nutrition during the evening at such a young age. And so we would never want stopping that or any actioning something from our side that would prevent nighttime waking for feeds and part of the growth.
Absolutely. Yeah. And maybe if I do just jump in with just the nutrition, like you said, I think it is so critical for their brain development that they have regular feeds in the night, because if they can't manage to maintain their blood glucose, and that's how they actually manage their blood glucose, which is feed in their brain. So it is appropriate for those regular wake-ins and regular feed-ins at that age during the night, 100%.
Yeah. And then maybe just a last thought around that is just, I'm a very big believer in how we set our kids up for sleep success from early on, but that is a really long journey and trajectory that lies ahead. And part of that is starting to think about bedtime routine, how we encourage sleep associations, what we can do in the room. So we don't think about sleep training, but we start thinking about how can we set our kids up for sleep success, and what are things that we can start implementing early on that lay a good solid foundation for healthy, good sleepers down the line.
I love that. That's so good. Sure. Thanks, Jenny.
Okay, Kath, I'm going to jump in with a question for you.
Sure.
So we've had a mom that said, my boy is 10 months old, a slow to warm up baby who has not yet been introduced to shellfish. Is this an allergen type food that I should try to expose him to ASAP? He has eaten all the other common allergenic foods such as fish, salmon, various nuts, seeds, etc., but I've not yet given him any type of shellfish. So I was wondering when you think it would be best to try expose to this.
Oh, shame. And that's such a good question, actually. And well done to that mom for introducing her baby to all the allergens, because we no longer wait until after a year to do eggs and peanuts and all those things. We do it in those early months, like between 4 and 6 months, actually. But when it comes to shellfish, and that is quite exotic, and I don't think a lot of families are regularly serving up shellfish in their homes, and especially not in our kind of environment. So if that is your environment and a common food that you're eating in your culture, then it would be appropriate that you feed your child those foods. But it is interesting that shellfish is not a common, it's actually unheard of as a pediatric allergy. So it's more common in the 30-year age group and older. And for what reason, we're not 100% sure. So introducing your little one to shellfish is definitely not a necessity to protect them from a shellfish allergy. And like I say, they are highly, highly unlikely to have an allergic response to shellfish. And if anyone's child has experienced it, it's often when there's a bacteria in the shellfish or there is something that's not great and they react to that. And then we think, oh my word, they've got a shellfish allergy. And that's often common with fish, because even fish is not a very common pediatric allergy, but shellfish is pretty much unheard of. So I would say to that mom, there's no rush whatsoever. And if she's got a little slow to warm up baby who takes time, trying to get used to foods and onto foods, there's so many other foods that she can expose her child to. I wouldn't rush with the shellfish. So
that's what I love about this podcast, is just that I feel like I learned so much every single time. And that was really so interesting. I'm actually allergic to shellfish. And just thinking about that question, it really made me think. And I don't think I've ever exposed my kids, because it's just not something I would cook because I'm allergic. So it's not a type of food that we have at home. And to think about exposing to our kids. So really helpful.
And that is something that's actually a very interesting point, because it is often, like I say, it's a later developed allergen. And it is often then those parents that are feeling like, should they be exposing? And we don't really want them to be exposing, because they're at more risk by exposing their child than what their child is. So, so you can relax.
Good, thank you.
Oh, this is a lovely question, Jenny. This is from a mom, and I just love how educated our moms are and our dads are out there. But she says she's read about the importance of secure attachment in the early months. Maybe you could also just explain for some of us out there exactly what that means. But she says she's worried because she has to return to work soon. Her baby's 3 months old and will be going into daycare. And she wants to ensure a strong attachment with her baby, despite going to be spending a bit less time with her.
Yeah. Oh, that's just, right up my alley, talking about attachment. So you'll have to definitely stop me, because I could go on for hours. But if we think about attachment, I think, what we are saying is really, we are looking at the relationship between a primary caregiver or parents and their child. And the research after many, many years has actually shown us that having a secure and solid attachment really does alter the trajectory of the life of the child ahead. We see major positive, optimal developmental outcomes for children with secure attachment. So it really impacts on almost every aspect of their life, from academic functioning to social relationships to general mental health and well-being. So we really can see what a significant and pivotal role attachment plays in the development of a child. And it's, it speaks volumes when a mom is conscious of that. I often say to moms, many of them come to me and say, I'm worried about this, or I'm thinking about that. And I often say, the fact that you're thinking about it probably means you're already doing so much of a better job than what you might think. The fact that you even know what attachment is, and that you're prioritizing it, and that you're worried about it, tells me that you're already doing so much right in the relationship. But I can fully understand that that is something that a lot of parents are very mindful of. And I think the beauty of attachment is it's not about a time thing or proximity of time, like how much time do we spend together. It's got nothing to do with, if I've spent 24 hours in a day with my child, I'm going to have a stronger attachment than someone that's only spent a handful of hours. In fact, the contrary is true. It's far more of a quality versus a quantity discussion. And if you can ensure that the times you are with your child, when you are feeding and waking in the night and get home from work and playing in the morning, that in those moments you are connected and present and attuned and doing all the things that you probably are already doing, those are the building blocks towards secure attachment. And so we really just need to be mindful of thinking about the time that we spend with our kids. And even as a working mom, this is something that is so front of mind for me, that there are many days that I'm not home as early as I want to be, or spending as many hours in the day with my kids. And I'm just so conscious that when I do get home, and the few hours I might have in the afternoon, that I'm really intentional about those hours, that I'm present, trying to be mindful of putting my phone away. I'm playing outside. I'm really engaged, because that is where we are building the attachment relationship.
I love that. Oh, that's encouraging to hear, I must say, because all us working moms, it's just so nice to know that in the time we've got, we can make it really special and really count. So,
yeah, absolutely.
Okay,
Kath, another one up for you. This one says, Kath, my little girl is now 8 months. I would like to start including more starch now as finger foods. I assume just normal bread is not great yet. Is there a better option for them? What about whole wheat pasta or even chickpea pasta? And I love this question because I felt like I wanted to add on that I even racked your brain about 2 weeks ago to say, Kath, my kids love bread. Is that fine? How much should they be getting? What's the best bread that they can eat? So I love this question. And I think it's such a relatable one for many parents whose kids like bread and pasta. And these are very accessible foods for us.
No, it's so good. Yeah, I love it. And I think it's also, there's a lot of noise out there, and it gets very confusing. Like, is all starch bad? Is anything like that's remotely bread, got the word bread in it or pasta in it, like really going to be terrible for my child? And I think, again, it comes down to, and I think we even had that discussion, what other foods are you feeding your children in the day? Are they getting enough fruits and veggies? And are they getting the good proteins? And are they getting some good nuts and seeds and those type of delicious foods? And then when you add the grains, which are really beneficial, it adds vitamin B and there's other benefits to it. It forms part of their healthy diet. And so it is important. And so, but it's again comes to, are we using the extremely refined breads that last on the shelf forever and a day? Or are we looking at breads that go potentially moldy? I love, and we mentioned it when you and I chatted, sourdough bread. It's got so many, like what nutrition and other benefits will that bread, is it live-in? I think that's the question. Is the food we feed in our children, is it live-in food, life-giving food? And the sourdough is great because a properly made sourdough bread will go stale very quickly, and it will grow moldy very quickly. So that means it's got so much life in it. The way that the process, it's calm, and it's a long process to make a sourdough bread. So there's a lot of good nutrition and good bacteria that go into it, which is good for your gut. So that baby at 8 months old can have toasted sourdough bread fingers and can munch on that, chew on it, play with it, and you can even put some nut butter on it and they can lick it off. And so that's a lovely one. Giving your baby some pasta is great. We've got so many varieties. The mom mentioned chickpea pasta. We've got whole wheat pastas. We've got good quality eggy pastas. You know, those old-fashioned pastas made with good egg are so good. So there's definitely, you can definitely introduce those, totally safe and totally appropriate. So I think that's basically our time up for these questions, but we'll definitely be following this on in our next week's podcast, where we will finish off some of the questions that you have brought to us because they were so excellent. So we definitely don't want to leave this. So I hope you enjoyed today and found value, whether they were your questions or you related to the questions. And then we look forward to seeing you next week as we further answer some of the wonderful questions that you brought to us. Thanks so much and have a great week.